Have you ever heard a headline like "State wins $500 million in opioid settlements"? And you think, good, justice. But then you look around your community and nothing feels different. Today, we're pulling back the curtain on where this money really comes from, how these lawsuits began, why fentanyl cases are so complicated, and what blood money actually means to families like mine. Because behind every $1 billion settlement is a son like Logan, or someone's daughter, someone's sibling, someone's parent, someone whose life had value. And the truth is, not all accountability looks like justice. Not all justice feels like healing, and not all money creates change. Welcome back to Logan's Voice. I'm Doug, Logan's dad. If you're listening on YouTube, please hit subscribe and tap that bell so you never miss an episode. When you like, comment, and share, you help push this message into the lives of people who desperately need it. You can also learn more at logansvoice.org. Let's talk about the lawsuits, the settlements, the fentanyl crisis, and who really pays the price. Before fentanyl, before counterfeit pills, the modern opioid epidemic started in doctors' offices. In the late 1990s and early 2000s, companies pushed prescription opioids as safe, long term, and low risk. Doctors were misled, patients were misled, communities were blindsided. People became physically dependent, then addicted, then desperate. When the prescriptions stopped, withdrawal didn't. People turned to heroin, then to pills on the street, and eventually to fentanyl, often without knowing it. This is the environment that set the stage for the lawsuits. Let's talk about the lawsuit that changed everything: Purdue Pharma and the Sackler family. Purdue aggressively marketed Oxycontin as less addictive than other opioids. Sales reps were trained to overcome objections. They told doctors that what looked like addiction was pseudo addiction, meaning the patient needed more opioids, not less. Internal documents later showed Purdue knew addiction and misuse were widespread, and the Sackler family, who personally approved marketing strategies, became billionaires off this damage. Families and communities filed thousands of lawsuits. Purdue Pharma filed bankruptcy, a protective move. The Sacklers agreed to pay billions but demanded immunity from future lawsuits. Families were divided. Some wanted the money to flow now. Others refused to let the Sacklers buy their way out of accountability. This case set the blueprint for how opioid settlements work today. And it's important to understand the opioid settlement funds that communities receive today exist because of the suffering people endured during the prescription opioid era. Make no mistake. Once prescription opioids were restricted, people already dependent turned to street supplies. What they found was heroin, then counterfeit pills, and now fentanyl, a synthetic opioid 50 times stronger than heroin and often hidden in fake pills. Here's the difference in the fentanyl era: there is no single corporation to sue, there is no Sackler family, there is no manufacturer with a mailing address. Instead, you have global precursor suppliers, illegal pill presses, cartels, online retailers, and street level dealers. Criminal prosecutions for fentanyl cases do not create recovery money. They send someone to prison, but they don't build treatment centers or prevention programs. That's why civil settlements, like the Purdue case, are so crucial. They are one of the few large scale sources of funding communities get. So, where does opioid recovery money really come from? Most of all, it comes from civil settlements with opioid manufacturers, pharmaceutical distributors, and major pharmacy chains. These companies agreed to pay billions over decades. The money is divided among states, counties, tribes, and cities based on overdose impact. population and documented harm. And on paper, the money must be used for treatment, prevention, recovery housing, youth education, harm reduction tools, mental health services, and community based programs. But once the money arrives, politics, bureaucracy, and a lack of transparency can get in the way. This is where good stewardship matters. This isn't just a story of failures. There are places using this money wisely and saving lives. Let me highlight just a few. Naloxone is saving lives. One of the most powerful uses of settlement dollars is expanding access to naloxone, the medication that reverses opioid overdoses. States and counties are stocking schools, equipping police cars and fire trucks, training teachers, installing naloxone boxes, and giving it out in libraries and community centers. Experts believe that widespread naloxone distribution played a role in the drop in overdose deaths reported in parts of the U.S. in 2024. You can't recover if you're not alive. Naloxone buys time, and it saves lives. The Arkansas Opioid Recovery Partnership is one of the best models in the country. Formed in 2022, it manages settlement funds for all 75 counties and has already distributed $26.3 million. They've funded 142 projects statewide, and these include school prevention programs, treatment beds, hospital based services, drug task force support, youth education, and community recovery organizations. Preliminary data showed that a 13% drop in overdose deaths in Arkansas in 2023. Is that all because of settlement funds? Not necessarily, but it shows what happens when money is used wisely. Other states with strong transparency are California. They received 362 million in 1 year, sent 61% directly to cities and counties, and they publish yearly public spending reports. In Oregon, it detailed spending reports, ensures rural and tribal communities receive funding. Transparency builds trust, and trust leads to better outcomes. And then there's small communities making big impacts. In Benzie County, Michigan, a small rural area, officials use settlement funds to purchase 19 defibrillators for EMS and law enforcement. Not glamorous, not big headlines, but absolutely life saving. John Hopkins developed 5 core principles: spend to save lives, use evidence based strategies, focus on youth, address equity, and be transparent. Communities that follow these principles tend to see real progress. In short, good stewardship is possible. And when it happens, lives are saved. So, with prescription opioids, one company made the drug and marketed it aggressively. Legally, that's a clear target. With fentanyl, the supply chain is shadowed and international. There's no big corporation with a headquarters to sue. What we're left with is scattershot lawsuits, criminal prosecutions, and a whole lot of heartbreak. Families often feel like accountability evaporates when responsibility is spread across an entire supply chain. Here's the hardest truth: every settlement dollar is a receipt for suffering. This blood money exists because people died, because systems failed, because corporations lied, because the drug supply is poisoned, and because families like mine will never be the same. Money does not restore a life, but it can honor a life if it's used to prevent the next death. That's the battle. I'm not speaking today as a policy expert. I'm speaking as Logan's dad. The recovery money that exists today, the lawsuits, the settlements, the billions of dollars, wouldn't exist without people like my son. Logan deserves a legacy. Your loved ones deserve a legacy. Their lives should shape the way these funds are spent. I will not stop speaking out because my son cannot. You don't need to be an expert to create change. You can ask your county how they're using settlement funds. Attend public meetings, demand transparency, support community organizations, share your own story, advocate for children left behind, push for education in schools, carry naloxone, support people still struggling. Your voice matters. Your grief matters. Your advocacy matters. If this episode helped you understand the legal side of this crisis or gave you a new way to talk about what's happening, please subscribe to Logan's Voice on YouTube. Share this episode with someone who needs clarity and visit logansvoice.org to learn more about Logan's story. Our children's lives matter. Their stories matter. And their voices through us continue. I'm Doug. I am Logan's voice. I am Logan's dad, and I will not be silent.